Hello and welcome to our webinar on individual psychotherapy. My name is Jennifer Boniface and I am one of the nurse analysts with the Provider Outreach and Education team. Today's webinar will focus on the coverage criteria and documentation requirements related to CPT codes 90832, 90834, and 90837, which is individual psychotherapy. On this next slide, you'll notice some acronyms that were used throughout the presentation. While you may already be familiar with many of them, feel free to refer to this slide if you come across an acronym you don't recognize. Before we get started, I'd like to point out the disclaimer at the bottom of the slide. By remaining in the webinar, you are agreeing to comply with the terms outlined in the disclaimers at the end of the presentation. So let's get started. According to the National Institute of Mental Health, mental illnesses affect tens of millions of individuals in the United States each year. However, research indicates that only about half of those affected receive treatment. Our objective for today is to understand Medicare coverage criteria and documentation standards related to individual psychotherapy. And we will cover the definition of individual psychotherapy, Medicare coverage criteria, and Medicare documentation requirements. So before we dive into CPT codes 90832, 90834, and 90837 for individual psychotherapy and their associated coverage criteria, I'd like to first show you how to access the local coverage determination that outlines the guidelines for these services. And you can find coverage guidelines for individual psychotherapy in LCD L34616, Psychiatry and Psychology Services, along with Billing and Coding Article A57480, Psychiatry and Psychology Services. The links to both of these policies have been placed in the chat, and you can refer to them at any time for more detailed information on each policy. We refer to these documents when making determinations for individual psychotherapy claims. There are two different ways to find this LCD. The first place is on our website on the home page. So I'm going to go there now to show you how to access this LCD. So if you go on the left-hand side of the screen, you'll find the code Lookup tool. Click the radio button that says LCD and Article Lookup, then enter the code, title, or description in the text box. And I've already typed psych in this box to get us started. Next, click the search button. So here we can see both the LCD and the billing and coding articles for this topic. And I'm going to select LCD L34616, Psychiatry and Psychology Services, by clicking on that title. And this will take you to the tools section of our website. The LCD and or billing articles, as you can see right here, that fit that description will be displayed here. And you can also go directly to our tools section of our website and search for the LCD there. After locating the correct LCD, click on the link to the selected LCD within CMS's Medicare coverage database. So we're going to do that now. And we're going to make sure that we click on that drop-down arrow right here under contractor information to make sure we're viewing the correct policy for the jurisdiction that we want. And for your jurisdiction, which is WPS, you want it to say Wisconsin Physician Services Insurance Corporation. And to save this LCD for easy access, you can just click on this basket here in the upper right corner. Another way to find the LCD is by accessing the MCD or the Medicare coverage database directly from the CMS website. And so I'm going to go there now and demonstrate how to access this LCD in the Medicare coverage database. So right here, you're going to type in a keyword, code, or document ID in the text box. So I'm going to type in psychiatry. And as you can see, when you type in psychiatry, several policies come up. So the simplest way and This one we can find fairly easily, but sometimes you can't. So the simplest way to locate a WPS policy is by selecting your state. So I'm going to choose Iowa because that's the first one that came up on my list for one of the states in our jurisdiction. So that will show you exactly which policy goes for WPS. So I'm going to choose this policy right here, and it's going to load in that MCD system. Again, you want to click down on contractor information just to make sure you're in the correct contractor for your jurisdiction. And you can also save this LCD by clicking on that basket right here. So let me show you just a little bit of the information you can find that's included in this LCD. So here is where they get some of their resources of coverage guidelines, which include indications, limitations, and medical necessity, and some of the topics under that coverage guideline. Here's limitations. Next, we can go to documentation requirements, if there's any utilization requirements, some sources of information, a bibliography, which is not applicable for this one. Then at the bottom of the LCDs is the revision history information, so it shows the different revisions and what was done and the date. I'll scroll to the bottom of that. And finally, it shows some related national coverage determinations and related coverage the documents. And again, this is that article, that billing article, which goes along with this policy. Okay, now that I've shown you how to locate the LCD, let's take a closer look at individual psychotherapy and the coverage criteria outlined in LCD L34616. And we will begin with a definition of individual psychotherapy. Local coverage determination L34616, Psychiatry and Psychology Services, defines psychotherapy as a treatment for mental illness or behavioral issues in which the clinician establishes a professional therapeutic relationship with the patient. Through focused therapeutic communication, the clinician works to reduce emotional distress, modify maladaptive behaviors, promote personality growth and development, and support the ongoing assessment of the patient's functioning. Individual psychotherapy is a therapeutic intervention involving one-on-one relationship between a patient and a licensed mental health professional. Sessions are conducted in a confidential environment and focus on identifying and addressing emotional, behavioral, and psychological concerns. The goal is to alleviate psychological distress, improve coping skills, and support the patient's overall mental health and daily functioning. CPT codes 90832, 90834, and 90837 represent individual psychotherapy sessions when provided face-to-face between a licensed mental health provider and the patient. CPT code 90832 is used for individual psychotherapy sessions lasting approximately 30 minutes, specifically those ranging from 16 to 37 minutes in duration. CPT code 90834 denotes individual psychotherapy sessions of around 45 minutes and should be used for individual psychotherapy sessions lasting 38 to 52 minutes. CPT code 90837 represents individual psychotherapy sessions of around 60 minutes and should be used for individual psychotherapy sessions lasting 53 minutes or more. CPT code 90837 applies to longer, more intensive sessions intended to manage complex emotional or psychological challenges that cannot adequately be addressed in shorter visits. According to Medicare guidelines, individual psychotherapy sessions must be medically necessary and tailored to the patient's needs. The type, frequency, and duration of therapy should be appropriate to the patient's mental health condition and treatment goals. Common therapeutic approaches may include insight-oriented therapy to help the patient gain awareness of their thoughts and emotions, behavioral modifying therapy, which focuses on changing maladaptive behaviors, supportive therapy, in which the patient receives emotional support and develops coping mechanisms, and collaborative or interactive therapy, which uses a variety of techniques to actively engage the patient with the therapist. Family members may occasionally be included in sessions, but only when their involvement directly supports the individual's treatment goals without shifting the focus away from the patient. Use of these codes is appropriate as long as the service complies with established clinical and billing guidelines. Before we move on, I want to provide a little more clarification about CPT code 90837. This code is frequently used for longer, more intensive sessions that provide comprehensive therapeutic services. It's appropriate in cases such as when additional intensive intervention is clinically indicated, such as for severe anxiety or major depressive disorders, for complicated or severe mental health conditions requiring in-depth treatment, such as bipolar disorder or complex post-traumatic stress disorder, and when exploring and analyzing emotions and thoughts that cannot be effectively addressed in shorter sessions, such as trauma processing or working with personality disorders. Individual psychotherapy sessions are billed based on the duration of the therapy session. Psychotherapy sessions lasting less than 16 minutes should not be reported. Medicare requires that the session duration be thoroughly documented, including the exact start time and end times, or the total time spent in direct therapeutic interaction, and that this information be clearly recorded in the patient's medical record. CPT codes 90832, 90834, and 90837 are used only when no other evaluation and management service is billed during the same session. If psychotherapy is provided alongside a separate E&M service, CPT code 90833, 90836, or 90838 should be used instead. Sessions frequently address the evaluation and treatment of a wide range of mental health conditions, including major depressive disorder, bipolar disorder, anxiety-related conditions such as generalized anxiety disorder, panic disorder, post-traumatic stress disorder, obsessive-compulsive disorder, and more complex issues, including personality disorders and psychotic disorders. The sessions may also focus on trauma recovery, providing a safe space for individuals to process and heal from difficult experiences, including childhood abuse, where individuals can explore the emotional impact of early trauma and work toward healing and self-compassion, sexual assault, offering a space for survivors to understand and process the lasting emotional effects and work on rebuilding trust and self-worth, domestic violence, helping individuals understand the psychological effects of abuse and develop coping strategies to regain safety, control, and empowerment, crisis intervention, addressing urgent concerns such as suicide risk or self-harming behaviors with immediate support and safety planning to prevent harm and stabilize the individual, grief and loss, supporting individuals through the emotional challenges of mourning, helping them find resilience and ways to cope with the pain of losing loved ones, and relationship and attachment issues, focusing on unhealthy relational patterns, exploring past attachments, and helping individuals build healthier, more secure connections moving forward. These sessions offer the opportunity to reflect on emotions, share personal experiences, develop coping skills, and work toward healing and recovery in a supportive environment. Treatment modalities commonly employed during these sessions include cognitive behavioral therapy, dialectical behavioral therapy, and psychodynamic therapy. These approaches assist with identifying and modifying maladaptive thoughts, behaviors, and emotional patterns to promote improved mental health and functioning. Next, let's briefly review the benefits of individual psychotherapy. Individual psychotherapy offers a range of benefits. A key advantage is the opportunity for more comprehensive therapeutic work made possible by the extended time allocated. This is especially beneficial for individuals facing mental health challenges, as additional time allows for the creation of a safe, supported, and validating environment. Longer sessions not only enhance the individual's well-being, but also promote stronger engagement and trust, which can lead to a more significant progress toward achieving personal goals. Next, we're going to review coverage criteria for individual psychotherapy sessions. Let's begin by discussing frequency and duration. CPT codes 90832, 90834, and 90837 cannot be billed together on the same day for a single patient. A provider should select only one code per day that accurately reflects the total face-to-face time spent in a psychotherapy session. CMS does not impose a set limit on the number or duration of individual psychotherapy sessions a beneficiary can receive. However, continued coverage depends on whether the services are considered reasonable and necessary for the patient's diagnosis and treatment, and this must be supported by ongoing clinical documentation. Several factors influence treatment outcomes, including the nature of the illness, prior history, treatment goals, and the patient's response. As long as the patient demonstrates progress according to their personalized treatment plan and the frequency of sessions aligns with standard medical practices, coverage may continue. However, if further improvement is unlikely and additional treatment is deemed unnecessary, outpatient psychiatric services will no longer be considered medically necessary. For psychotherapy sessions lasting longer than 90 minutes, reimbursement will only be approved if the medical record clearly documents the face-to-face time with the patient and provides justification for the extended duration based on the medical necessity. All outpatient hospital psychiatric services need to meet the criteria outlined in the Medicare Benefit Policy Manual, Chapter 6, Hospital Services covered under Part B, Section 70.1.A. The first requirement is having an individualized treatment plan. Services need to be prescribed by a physician and provided based on an individualized written plan of treatment developed by a physician after consulting with appropriate staff members. The plan should outline the type, amount, frequency, and length of services, as well as the patient's diagnoses and expected goals. However, if only a few brief services are provided, a plan is not required. Next is physician supervision and valuation services. A physician needs to supervise the services and regularly assess how well the treatment goals are being met. These evaluations should include frequent consultations and discussions with therapists and staff, reviewing medical records, and meeting with the patient. The physician's documentation in the medical record should clearly reflect this involvement. Additionally, the physician should provide direction and supervision to any therapist involved in the patient's treatment and check in periodically to evaluate progress and determine if adjustments to the treatment plan are needed, ensuring that the goals continue to be achieved effectively. The last requirement we will discuss is reasonable expectation of improvement. Services must either be for diagnostic purposes or reasonably expected to help improve the patient's condition. At a minimum, treatment should focus on reducing or controlling psychiatric symptoms, preventing relapse or hospitalization, and maintaining or improving the patient's level of functioning. It is not necessary for treatment to restore the patient to the exact level of functioning they had before the illness, although that might be the goal for some patients. For many patients, especially those with long-term or chronic conditions, the focus is more on managing symptoms and preventing further decline or hospitalization, which is considered a reasonable outcome of treatment. Improvement is evaluated not only by symptom reduction, but also by the anticipated effects of discontinuing treatment. If there is a reasonable expectation that stopping treatment would result in a decline in the patient's condition, relapse, or increased risk of hospitalization, then continued treatment may be considered medically necessary. Some patients may improve to a certain point, but eventually reach a level where further significant improvement is unlikely. However, this does not automatically make treatment non-covered just because the patient has stabilized. Our goal is now to maintain their current level of functioning. Coverage depends on whether the criteria we discussed are still being met. Once stability can be maintained without further treatment or with less intensive care, the services are no longer considered medically necessary and would not be covered. Individual psychotherapy must be facilitated by a provider who is legally authorized to deliver this service according to state laws and practices within their professional scope. Providers are eligible to perform and bill this service through Medicare as long as they are properly enrolled and credentialed. Eligible providers include physicians such as doctors of medicine and osteopathy, clinical psychologists, clinical nurse specialists, nurse practitioners, certified nurse midwives, and physician assistants. These providers may also bill under the Incident to provision, which allows qualified mental health providers to deliver treatment in collaboration with a supervising physician or certain qualified non-physician practitioners. This provision ensures compliance with Medicare regulations while supporting Medicare beneficiaries in accordance with state laws and regulations. Additionally, other qualified mental health care providers, including master level and doctoral level clinicians such as licensed clinical social workers, licensed professional counselors, licensed mental health counselors, and licensed marriage and family therapists, may render these services if they are authorized by their state and enrolled in Medicare. Billing is permitted only in accordance with applicable Medicare regulations. Before billing under the Incident to provision, it's essential to confirm that the billing healthcare provider is authorized by Medicare to supervise and bill for these services. This helps ensure compliance with both Medicare regulations and state licensing requirements. For more information about mental health providers, please refer to MLN 198-6542 Medicare and Mental Health Coverage, and a link to this resource is available on the resources slide at the end of the presentation. You can also watch our Encore presentation titled Encore Part B Mental Health Incident 2 for additional details on mental health providers and Incident 2 services. This presentation is part of the mental health playlist on our YouTube channel, and a link to this YouTube playlist can also be found on the resources slide at the end of the presentation. Before we proceed, I want to address a question we received about licensed clinical addiction counselors, or LCACs. The question asks if they can be enrolled to provide individual psychotherapy. Licensed clinical addiction counselors cannot bill Medicare directly for individual psychotherapy services, as they are not recognized as eligible providers to independently bill Medicare for these services. However, LCACs may be able to render addiction counseling and substance use disorder treatment under Medicare, but only under specific conditions, such as working under the supervision of an eligible provider or as part of a treatment team. Additionally, LCACs must be authorized by their state and enrolled in Medicare to provide these services. When psychotherapy includes different types of techniques, there are certain limitations on services that fall outside its scope. Psychotherapy services do not include teaching grooming skills, monitoring activities of daily living, recreational therapy such as dance, art, or play, social interaction, or oversight activities such as managing housing or finances. In addition, psychotherapy services are not covered for individuals with severe or profound intellectual disabilities. Similarly, those who experience significant cognitive impairment due to senile dementia may also not qualify for these services, particularly when the clinical record indicates the therapy would be ineffective. Certain factors, such as communication issues, can complicate the delivery of individual psychotherapy. Interactive complexity refers to communication problems that occur during psychiatric procedures. When communication challenges are present, the psychotherapy session tends to be more intense and require greater effort from the clinician, although it does not affect the overall session length. Despite these added challenges, the time for the session remains the same. These communication difficulties are often encountered in those who have individuals legally responsible for their care, such as in the case of minors or adults with guardians, require others to be present during the visit, such as those needing family members, interpreters, or translators, or have third-party involvement in their care, such as welfare agencies, probation officers, or educational institutions. Interactive complexity may be reported when at least one of the following conditions is present. Need to handle maladaptive communication, such as high anxiety, emotional reactivity, repeated questions or disagreements, which complicates care, caregiver emotions or behaviors that disrupt the treatment plan, evidence of a sentinel event that must be reported to a third party, like abuse or neglect, along with discussions about this incident, a report with the patient or others involved, or both, or use of play equipment, physical aids, interpreters, or translators to address significant language barriers. If one of these conditions is present and is medically indicated, the Interactive Complexity Add-on Code 90785 may be billed in combination with the individual psychotherapy. Interactive Complexity CPT Code 90785 is an add-on code used for psychiatric services that address communication challenges that occur during psychiatric treatment. It may be reported with CPT codes 90832, 90837, and 90834 when interactive complexity is used for a person receiving individual psychotherapy. Add-on codes can only be reported alongside other codes and should never be used on their own. The CPT add-on code for interactive complexity should not be used with psychotherapy for crisis codes or with evaluation and management services when no psychotherapy service is also billed. Additionally, this code should not be used for individuals if they are able to communicate through ordinary verbal means. Individual psychotherapy is telehealth eligible. The requirement can be met through audio-only interaction. Currently, an in-person visit is not required within 6 months of an initial Medicare behavioral or mental health telehealth service, nor annually thereafter until January 30th, 2026. This also applies to federally qualified health centers and rural health clinics, where the in-person visit requirement for mental health services provided through communication technology to beneficiaries in their homes is waived until January 30th, 2026. Additionally, beneficiaries who start receiving mental health telehealth services in their homes before January 31st, 2026 are considered established patients. This means if a beneficiary begins care on or before January 30th, 2026, they are not required to have an in-person visit within 6 months. Instead, they must have at least one in-person visit every 12 months. For more information about telehealth and mental health services, please refer to MLN 198-6542 Medicare and Mental Health Coverage and the Telehealth Policy Update section on the telehealth.hhs.gov website. Additionally, you can learn more about telehealth policy by reviewing our Encore presentation titled Encore Overview of Medicare Telehealth Policy, Past, Present, and Future, and a link to that Encore presentation has been placed on this slide. Since reimbursement for individual psychotherapy services is based on the actual face-to-face time spent with the patient, it is important for mental health providers to keep accurate records of the time spent and bill using the correct codes for the services performed. CPT code 90832, 90834, and 90837 should only be billed for sessions dedicated exclusively to psychotherapy. If psychotherapy is combined with other services, such as evaluations or testing, different CPT codes must be used. Proper medical documentation is essential to ensure psychotherapy services are accurately coded, reimbursed, and clinically justified. A clear mental health diagnosis is required, along with an updated treatment plan outlining the patient's specific goals and interventions being used. Claims must include a covered diagnosis to establish medical necessity, and documentation must support the use of appropriate ICD-10-CM and CPT codes, ensuring the selected codes align with the services provided. When documenting individual psychotherapy, it's essential to include several key components in the medical record. Let's review these components one by one. The first component is documentation of covered diagnosis. The medical record should include a supporting diagnosis that justifies the need for individual psychotherapy. Documentation should clearly reflect the presence of a psychiatric illness and/or emotional or behavioral symptoms that significantly alter baseline functioning. This covered diagnosis is required to support the medical necessity of the individual psychotherapy. Next is documentation from the individual psychotherapy session. Each session should include a detailed summary that documents start and stop times, therapeutic interventions, the patient's responses, the patient's level of interaction and participation, any progression or regression in symptoms or behavior, and progress toward established treatment goals. Documentation from the individual psychotherapy sessions should include, but is not limited to, topics addressed during the session, details regarding interventions and activities delivered during the individual psychotherapy sessions, descriptions of the expected benefits of individual psychotherapy sessions, including anticipated outcomes and improvements to the patient's health status and functionality from receiving treatment, details regarding the patient's capacity to engage in and benefit from attending the session, documentation of the estimated frequency and duration of sessions, as well as an estimate of how many sessions are planned, and documentation of periodic summary of goals set, the progress achieved toward those goals, and any updates to the treatment plan as necessary. Ensure the progress notes from individual psychotherapy sessions are dated and signed, including the credentials of the clinician facilitating the session. The third required component of documentation is the treatment plan. Treatment plans should be reviewed periodically, typically every 3 months, to reflect progress toward goals, estimate duration of treatment, targeted symptoms, and any updates to the treatment methods, whether behavioral, cognitive, or pharmacological. Therapeutic maneuvers, such as behavioral modification or supportive interactions, should be well documented to show their role in producing therapeutic change. It's important to note that behavior modification is not billed as a separate service, but functions as an adjunct to psychotherapy. Elements of the treatment plan may include presenting issues and diagnosis, clearly defined treatment goals, specific interventions to be used, methods for tracking progress toward goals, justification why the selected psychotherapy is a suitable treatment approach, and plan for addressing potential challenges that may arise. The treatment plan should also be signed by the clinician. Documentation to support medical necessity is the next required component. To support the medical necessity of individual psychotherapy, documentation should reflect that the patient is benefiting from participating in individual psychotherapy by showing improvement in target symptoms, actively engaging in sessions, and progressing toward established goals. This documentation should be included in the medical record to justify the need for continued treatment. For prolonged treatment, the medical record must support its medical necessity, showing that ongoing care is clinically justified. This includes documenting the patient's capacity to participate in therapy and validating that the selected treatment modality is appropriate. Finally, if billing for interactive complexity, documentation must explain the patient is unable to communicate effectively through typical verbal means and describe the adaptations used during the session. Include the rationale for these techniques and recommendations for future care. Please note that this list is not exhaustive and additional documentation may be required to support claims. Be sure to include an advance beneficiary notice of non-coverage if applicable. The ABN informs beneficiaries about services they may not be covered by Medicare, helping them to understand their financial responsibilities before receiving care. This notice is crucial for ensuring transparency and avoiding unexpected charges. Medical records must be thorough, legible, and contain essential information such as patient identification, dates of service, and the provider's signatures and credentials. Incomplete or unavailable documentation may lead to denied claims. Therefore, maintaining comprehensive, timely, and accurate records is critical for compliance, continuity of care, and reimbursement. And before we finish up, I want to address this pre-submitted question we received regarding documentation. The question states, providers will use summary sheets for billing that include the necessary documentation requirements such as diagnosis, time, modality, goals, progress, etc., while keeping the full psychotherapy note secure. Is it necessary in the summary to put the specific symptoms addressed? When creating billing summary sheets for psychotherapy, it's important to balance documentation requirements with patient privacy. While these sheets must include the patient's diagnosis, session time, modality, and progress, specific symptoms don't need to be detailed. For example, instead of focusing on symptoms such as anxiety, you can generalize by noting treatment progress like working on anxiety management. The key is to keep sensitive symptom details in the secure psychotherapy notes, which are separate from the summary sheet. The summary should emphasize overall progress, therapeutic goals, and interventions without revealing personal clinical information, ensuring confidentiality and compliance with billing standards. Individual psychotherapy is a therapeutic approach involving a one-on-one relationship between a patient and a licensed mental health professional. This process facilitates the assessment and treatment of psychological, emotional, and behavioral issues through targeted interventions focused on improving the patient's mental health and overall functioning. So as a recap, during today's webinar, we reviewed coverage criteria and documentation requirements for individual psychotherapy. We defined individual psychotherapy, discussed Medicare coverage criteria, and reviewed Medicare documentation requirements for CPT code 90832, 90834, and 90837 individual psychotherapy. This slide provides several helpful resources, including links to MLN 1986542, Medicare and mental health coverage, LCD L34616, Psychiatry and Psychology Services, and LCD reference article A57480, Billing and Coding, Psychiatry and Psychology Services. You will also find links to the WPS articles Psychotherapy and Documenting Time in Medical Records, as well as the mental health playlist on our YouTube channel. This playlist offers further information on a variety of mental health topics we have covered. Please refer to this slide as a reference when reviewing the presentation. We are now at the end of the formal presentation. Please remember, if you have any questions, please put those questions in the chat feature and select Send to All Panelists. If we don't get to your questions today during the presentation, we will send out a document to all participants with the answers following this webinar. So before we go into questions in the chat, I want to address two pre-submitted questions we received. Question number one asked to please clarify how to document functional status. Documenting functional status in individual psychotherapy involves describing how a patient's mental health symptoms impact their ability to function in daily life. This includes assessing and recording functioning in key areas such as activities of daily living, such as personal care and hygiene, emotional regulation, work or school performance, interpersonal relationships, and overall physical and mental well-being. Clinicians should note current level of functioning, any changes since the previous session, and whether functioning has improved, declined, or remained stable. Documentation should clearly connect these changes to presenting symptoms and to specific therapeutic interventions used during treatment, including what the patient reported about their own experiences, what the clinician observes in sessions, and, when appropriate, feedback from family members or other family member supports, helps provide a clearer, more complete picture of the patient's functioning. Clear documentation of functional status helps track progress over time, identify ongoing barriers to improvement, support medical necessity, and guide treatment planning and adjustments. And question number 2 asked, what documentation is expected from a provider to demonstrate why the selected therapy is the appropriate treatment modality, either in place of or in addition to another form of psychiatric treatment? The provider should document why the selected psychiatric therapy is the most appropriate treatment for the individual patient, whether used alone or in combination with other psychiatric interventions, and why the service requires the skills of a licensed mental health professional. The medical record should include the patient's psychiatric diagnosis, presenting symptoms, severity, and associated functional impairment, and explain how these factors support the need for the chosen modality. Documentation must also reflect prior and/or current treatment, such as medications or other therapies, including their duration, adequacy, and the patient's response, partial response, non-response, intolerance, or contraindications. The provider should then provide a clinical rationale for selecting this therapy, clearly linking it to the patient's symptoms, risks, comorbid conditions, or treatment history, and explain why alternative or single modality treatments will be less effective or clinically inappropriate. Finally, the record should identify treatment goals and anticipated benefits, demonstrating continued medical necessity in accordance with Medicare criteria. And I'm going to go to questions in the chat. And the first one says, it was stated physicians need to create and align assigned treatment plan. Is this a, is this a needed requirement? And according to that, let me give you the exact reference again. It was on, and so you know where it is, it's because there's a link to it. I apologize. Let me scroll up to that. The Medicare Benefit Policy Manual, Chapter 6, Hospital Services covered under Part B, Section 70.1A, and that was on slide 17. It is a requirement that the physician create the treatment plan. However, the treatment plan can be created by a qualifying eligible provider. However, that treatment plan can be created alongside or collaborated with other healthcare providers. So while the treatment plan would be created by the physician or those eligible providers, there are mental health providers that can help or assist with it in the group. Okay. And I see that some of the questions have been answered. So Mary Sue, can you answer, or can you, ask me some additional questions in the chat? Because I'm having problems scrolling through the chat right now.
Sure, I'm just taking a look. Mary's answered most of the billing or all of the billing questions. There was one that came through on incident 2. There was, I don't know, did you hit the question regarding slide 17? They want a clarification. Must the provider document their reasonable expectation of improvement at each encounter?
The reasonable expectation of improvement should be, you should be reflecting some sort of documentation in each encounter discussing if there has been improvement or whether there has not been improvement, so that shows that there is progress. In a treatment plan, which is typically done every 3 months, you do want to address that reasonable expectation of improvement. So a short answer on that one, or the less complicated answer on that one, is you do want to address in each session something about whether there's been improvement, whether they're meeting those treatment goals in each session, or whether they're not. But the more extensive documentation would be in that treatment plan documentation every 3 months. And I'm hoping that answered
Right.
that question for you. Let me see.
Then there is a clarification. Please specify the expectation for estimated duration of treatment, how often that information should be documented or update. Would psychotherapy treatment every 6 months support medical necessity?
Well, the treatment plan should be updated about every 3 months. Notes are done every session. I'm not quite sure exactly what they're asking. If I can, let me see if I can find that question. Maybe I can clarify a little bit more.
Yeah, and just to add on to that, your treatment plan should be a fluid document too. As patients are progressing through therapy, goals are going to be achieved. Some goals may need to be updated, changed, modified based on that patient's needs and how they're responding to session. But you should be overall making sure that everything is being, addressed with each of your sessions and then updating those goals. And I know we're short on time because we only have scheduled till 9:50. There's a few questions in the chat that are, again, billing related, that we can take, and a few other questions that we can take and answer after the session is completed as well.
And I will send that out to all participants as well. So let's move. Thank you, Mary. So let's move forward. Okay, please take a moment to complete the survey and share your feedback. We will use your feedback to develop topics for future education, and you can access that survey by either clicking the link in the chat or by visiting the CMS Qualtrics page after the webinar. And again, we will send the questions and answers out on email after this webinar to all participants. So in a few minutes, you will receive an email thanking you for attending, which includes your certificate of achievement and a link to the survey. If you need contact hours for continuing education, they will also be in this email. If you don't see it, check your spam folder. And if you called in, please email us at wps.gha.education@wpsic.com with this webinar's name and your phone number that you used to call in, and we will send you your certificate of achievement. If you think of any additional questions after today's event, you have 7 days from today to submit them. Send them to our education mailbox at that email address, wps.gha.education@wpsic.com, and put the title of this webinar in the subject line. However, if you have claim-specific questions, please direct those to our customer service department. As Mary Sue Mary and Provider Outreach and Education does not have access to your claim information, so we are unable to look up claims. Also remember that we cannot accept any type of PHI or PII via email. Finally, on behalf of myself, Mary Sue, and Mary, as well as all of Provider Outreach and Education, thank you for attending today's webinar on individual psychotherapy. As a reminder, this presentation will be posted as an encore presentation on the Training Center page on our website. For more information on additional mental health topics, be sure to visit our YouTube channel and check out the mental health playlist. You can find the link to the playlist on our resources slide of the presentation. Remember to take our survey with the link provided. We look forward to your survey comments and hope to have you join us at future events. You may now disconnect.